Sudex osteodystrophy. Sudex osteodystrophy is also called a sympathetic osteodystrophy. So it's a post-traumatic painful condition. It is characterized by regional osteoporosis following a minor injury or fracture around the wrist and the hand. It is also called a CRPS, which is complex regional pain syndrome 1 or post-traumatic osteoporosis. The common risk factors are going to be Colles fracture. Apart from that, minor fractures of the wrist and hand injuries, surgery for carpal tunnel syndrome, and idiopathic. In pathophysiology is that there is abnormal activity of the autonomic nervous system. Increased sympathetic activity will lead to vasospasm. Vasospasm will lead to ischemic changes that will lead to pain, that will lead to disuse of that particular part, and that will lead to further osteoporosis of that bone, and this cycle will keep on continuing. So the clinical features, they are divided into three stages: acute stage for 0 to 3 months, 3 to 6 months where it is going to be a dystrophic phase, and an atrophic phase for more than 6 months. In acute phase, there is a lot of pain, there is a swelling, then the increase in temperature, that is a warm temperature, then the skin is red and shiny, tenderness is present, and stiffness is found in the fingers, that is distal stiffness is present in the form of fist. Then stage 2 is the dystrophy, where the pain is still present but it is less severe. Temperature, it reduces, and then the swelling also reduces. In the skin, it becomes cyanotic or pale in color. Then the nails and the hair loss takes place, and the stiffness is marked, that will lead to frozen joint, the frozen hand. In the stage 3 is atrophic for more than 6 months. The pain almost disappears or it very much decreases. The skin becomes glossy, and the muscle wasting takes place. In the joints, there is a fixed contractions that take place, irreversible stiffness, and in the bone, severe osteoporosis can be seen. So in the X-ray findings, in the bone there is a patchy osteoporosis, that is also called as spotty osteoporosis or moth-eaten osteoporosis. Spotty or moth-eaten osteoporosis is a characteristic of Sudex osteodystrophy. Periarticular involvement is present. Subperiosteal bone reception is seen in the phalanges. Diagnosis. So there is a clinical diagnosis where there is a history of injury. Apart from that, pain, swelling, stiffness is present. Imaging, X-ray will show patchy periarticular osteoporosis, or that we call it spotty or the moth-eaten osteoporosis. Bone scan, in all the three cases it will be increased uptake, and MRI will show bone marrow edema and soft tissue changes. Very important, in on Sudex osteodystrophy, the ASR and CRP levels are normal. In fat embolism they increase, but in Sudex osteodystrophy they are normal. Differential diagnosis can be rheumatoid arthritis, gout, or it may appear as a factitious disorder. Then management for stage 1 and 2 is there's a lot of pain, so pain relief is given. For the neuropathic pain, there's amitriptyline and gabapentin that can be given. Physiotherapy, that will lead to where we encourage the patient for active movement despite pain. And occupational therapy in the form of splinting. Sympathetic blockade by steroid cervical ganglion block. Steroids, calcitonin to decrease the subperiosteal resorption and bisphosphonates. In stage 3 late, where there is a complete stiffness, irreversible stiffness of the hand is taking place, and contractures, so contracture release surgery should be done. Then sympathectomy can be done, and intensive physiotherapy, and pain clinic referral is generally not needed as the pain has substantially decreased.